session is designed to help you build a strong foundation for understanding advocacy and how it applies to different areas of life. We're going to explore important tools and strategies to help you feel more confident and equipped in your advocacy journey. I also want to let you know that how thrilled we are. We have a special guest with us today. Her name is Marisa Brizzolara. She's a member of our Parent Advisory Committee, and she's here to share her personal advocacy journey and participate in the live Q&A session. Now, speaking of advisory groups here at ACMH, we also have a youth advisory group that we refer to as the YAC. So both the Parent Advisory Committee, the PAC, and the YAC, the Youth Advisory Committee, play a critical role in amplifying parent voices in mental health advocacy. And I'm going to share more about the group and how you can get involved later. So together, we're all deeply passionate about advocating for youth and families. But for now, I just want you to know you're not alone in this journey. We're here to support you. And we know how important it is to have the tools, knowledge, and confidence to speak up for your youth's mental health. Our goals for today are to introduce you to the fundamentals of advocacy. And we want you to be able to recognize key areas where advocacy is needed. We also want you to be able to identify some of the essential advocacy skills, and then be able to identify practical and actionable next steps. So a little bit about ACMH. ACMH is Michigan's statewide nonprofit family-run organization supporting families of children and youth with mental health challenges. This year marks our 35th year since ACMH was founded by parents who struggled to navigate the mental health system. They saw the lack of support. They took action, not just for their own families, but for others. And their vision grew into ACMH, a trusted family-driven resource for education, advocacy, and support. So what ACMH does is we connect families, we train youth peer support specialists and parent support partners. We also provide workshops, referrals, and advocacy. So by partnering with organizations across Michigan, we expand access to mental health services because we know when families, schools, and communities work together, children thrive. And our work is made possible through MDHHS, the Michigan Department of Health and Human Services, and SAMHSA. We get private donations, fundraising, and partnerships, all ensuring families and youth get the support they need. All right, so now that you know a little bit more about who we are, what we do, we're going to dive into learning about the basics of advocacy. So what is it? Okay, I've got a lot of items here. Starting from the left, it's about raising awareness, empowering families, influencing policies, and also supporting system navigation, building community, and championing youth voice. Some examples of what advocacy is are collaborating with school staff. It's also about navigating healthcare systems. Advocacy is about sharing lived experiences to drive change. It's about what we're doing here, connecting with other families for support, and promoting youth voice. There's obvious value to this. The empowerment piece empowers families, strengthens communities. It's about the people. It improves youth outcomes. It reduces stigma and drives systemic change. What is the difference between being an advocate versus advocacy? But an advocate is a person. Now, advocacy is more about a group of people or a movement. and different levels. To begin with, self-advocacy. There's advocating for others. Systems advocacy. This is about changing policies, rules, laws, or systems. And then there's legislative advocacy. This is about sharing information to educate lawmakers. The next couple of slides, I've created some tables for you. I'm not going to go through them here in detail. You'll have the slides afterward, but these tables are a great resource to understand the key comparisons between the different types and levels of advocacy. So for example, on this slide, you see individual versus group advocacy. The column on the left where you see the word factor, there's different factors to these types of advocacy. The level of autonomy, the reach and impact, support and resources. And then in the following columns, you have individual advocacy compared to group advocacy. So let's say we do reach and impact. On an individual advocacy level, it's limited unless you have a strong following that's been built and developed. Reach and impact of a group has a broader influence through collective action. And on the next slide here, I have some key comparisons for you when it comes to the local advocacy versus state advocacy versus national advocacy. Advocacy is not speaking for families without their input. Advocacy it's not a one-size-fits-all approach. It's also not about confrontation or conflict. It's definitely not a substitute for professional help. It isn't it's not only about complaints. It's never a quick fix. And it's not about pushing personal agendas. So where is advocacy needed? Advocacy obviously starts and is needed at home, right? Families are often the first to recognize mental health challenges, but stigma and lack of knowledge can prevent action. So advocacy here means normalizing mental health conversations and creating safe spaces for our youth. It's also needed in schools. We know that mental health directly affects academic success, behavior, and social interactions. It's needed in healthcare systems. Access to mental health professionals is limited, and insurance barriers make treatment difficult. So there's some advocacy needed there. It's also needed in communities. Stigma at the community level prevents families from seeking help, and youth-specific mental health services are often lacking. So advocacy here means creating peer support groups, hosting awareness events, and ensuring our youth's voices are included in community initiatives. Advocacy is also needed in the juvenile justice system. We know that many youth in the system have untreated mental health conditions, and they ultimately face punitive actions instead of support. It's needed in policy and legislation. Oftentimes, policies lag behind real needs, and funding is insufficient. So we need advocacy there. It's also needed in crisis response and emergency services. Law enforcement is often the first responder to youth mental health crises. This can escalate situations, so we know that advocacy is needed there. And let's not forget to mention that advocacy is needed in workplaces for caregivers, because parents and caregivers struggle to balance work with their child's mental health needs. Yet many workplaces lack flexibility. And family voices are the key to success, because Family members often know individuals best. They know their family members. So professionals need input from families. Providers see real life outcomes. And families, they can learn from one another. The role of families in shaping mental health policies has evolved significantly over the past few decades. This graphic that you're seeing on your screen, it shows that historically parents of children with emotional and behavioral challenges required some advocacy. So there's been some key advocacy successes here in the US at the federal level. The Individuals with Disabilities Education Act, or IDEA is the acronym. In 1975, that act was established. And before that, many children with disabilities, including those with mental health challenges, they were denied access to public education. Families got together and advocated and fought for change, leading to this law called FAPE, the acronym is, called Free and Appropriate Public Education in the Least Restrictive Environment. And then there's the Systems of Care movement that began in the 1980s to present. The System of Care movement shifted the approach to family-driven, youth-guided services, recognizing that mental health care works best when it's collaborative. And then we had the Family Voices movement in the US here. It was founded in 1992. It created a national network that amplifies the voices of parents advocating for children with special health needs, including mental health. The Michigan Department of Health and Human Services has developed a framework that shifts family from being passive recipients of care to active partners in shaping services. There's 4 key initiatives that strengthen the family-driven, youth-guided approach. Mentioned on the previous slide, Michigan System of Care Initiative, the Family-Driven Care Policy and Implementation, the Michigan Children's Mental Health Waiver Program, a significant impact, and the Michigan Mental Health Diversion Council and Juvenile Justice Initiatives. Many states across our nation have advanced families' needs greatly. So if you're not from Michigan and you're not aware, go ahead and do some research on your own and you can find out more about what's happening in your state. There's also some direct support and collaborative services initiatives that have been established. As I said, ACMH certifies parent support partners and youth peer support specialists, and now they're certifying crisis peer support partners. So across the state and our nation, the peer support network is recognized and evolving and growing over time. There's also the wraparound services in Michigan. And then the Michigan Family Voices and Family to Family Health was established. Collaborations with family organizations like ACMH. There's an abundance of collaboration going on across our state and nation, and plenty of opportunities to get connected and embedded into the support system. Universally, there's advocacy strategies that apply everywhere. So no matter where you are in the world, these core advocacy strategies empower parents and caregivers to make a difference. So you need to know your rights, understand the laws and policies, seek to build a support network, connect with other parents, caregivers, advocacy groups. Use your voice by sharing your story and advocating for better mental health policies. Collaborate with schools and providers. See where you can make a difference. Engage with global networks. You can learn from and contribute to international advocacy efforts. Before I share some examples, let's hear from you. What are some of the ways you've seen parents or caregivers get involved in mental health advocacy? And while you're thinking about that, we'll go ahead and get started on where to begin. First and foremost, it starts with your child's needs. Or maybe you have a family member or a youth that you're close with. It starts there. And then it's about connecting with parent networks, finding local or state organizations like ACMH or the Michigan Federation of Families for Children's Mental Health, engaging in support groups, training programs, or peer networks. You can dive in and build skills like you're here gaining awareness today. You could get involved in systems level advocacy. Tell your story. That's a great way to get started. When it comes to building foundational advocacy skills, there are really some basics here. You want to learn more about active listening. Communication involves active listening. Empathy, developing some empathy, being able to see how another person's perspective and how it's impacting them. You can learn about dispute resolution. I touched on the effective communication piece. Effective communication and active listening. These are things that we'll cover in the third session of this series. And also balancing emotion with logic. That's a skill that you can learn. Also, a foundational advocacy skill is the ability to build relationships. There's better outcomes when it's built through a relationship. And remaining focused on the desired outcome and not getting caught in the details or getting distracted. So now I'm going to go ahead and introduce you to our Parent Advisory Committee. Advocacy really is most powerful when it comes from those with lived experience. And we're going to learn more about this when Marisa joins us for Q&A. But the PAC, that's exactly what our statewide Parent Advisory Committee is all about. It's about a group of dedicated parents and caregivers who are using their voices to create meaningful change in children's mental health. Our PAC is made up of 13 parents and caregivers across Michigan who are currently raising children with mental health challenges and co-occurring disorders. There's many PACs around our state in different organizations and agencies, as well as other states across our country and other countries. Ours in particular, we meet monthly to discuss key issues, share experiences, and advocate for improvements in mental health services and policies. So our core commitments really are utilizing your voice, bringing lived experience to the table, influencing change, shaping mental health services and policies, raising awareness, breaking the silence on mental health. And therefore, our mission is we are committed to empowering families and strengthening mental health systems. And the PAC is a vital part of that work. Now, here is about the Parent and Youth Advisory Committee objectives under ACMH. And the Youth Advisory Committee and the PAC really are similar. They're just made up of different group dynamics. The PAC is about the parents and the caregivers, and the Youth Advisory Committee is all about the youth and empowering youth. But the same four objectives apply to both groups. And if you're curious about the Youth Advisory Committee, we do have the gal who runs our Youth Advisory Committee is on the call today. That's Nadia. And I'm not sure if Nadia has said hello yet, but Nadia is here. And Nadia, if you could put your email in the chat for folks in case they want to know more about our Youth Advisory Committee here at ACMH, that would be great.
Hi guys. Sorry, I didn't know if you wanted me to unmute or not, but hi everybody. I'm dropping my email in the chat right now.
Thank you.
Absolutely. Thank you, Diana.
You're welcome. So these focus areas, they demonstrate that the work of the PAC and YAC goes beyond advisory. We're really integral in building partnerships, supporting ACMH staff, and ensuring that our advocacy is both informed and impactful. So we play an advisory role. We have input and involvement on campaign development. And I mentioned support for ACMH staff and then advocacy efforts and to support family-driven and youth-guided policy. I'm going to introduce you to our special guest, Marisa Brizzolara. And I'm going to introduce her to you, and then she's going to share with you her story. And then we're going to open it up for Q&A. And we're hoping that this is going to be the part that we spend the most time talking about ways that you can get started, answering any questions that you have. Marisa, she is, as I said, on our Parent Advisory Committee. She's from Kent County, and her advocacy is making a statewide impact. Marisa's journey highlights the power of parent voice in shaping children's mental health policies and services. So as you listen to her story, I want you to consider how her experiences connect with your own advocacy efforts. Marisa has a BA in Women's Studies and Psychology from Aquinas College, and she brings lived experience as a parent into her work. She collaborates with the Michigan Department of Health and Human Services on youth crisis stabilization units and broader youth behavioral initiatives. She's also a certified independence facilitator. She champions person-centered planning and autonomy as a fundamental right. And in 2024, she joined the Leaders in Policy Advocacy cohort through Michigan Alliance for Families. She's also active in several advocacy networks. So these are advocacy networks you might be curious about and you might want to ask her some questions about. One is the Michigan Parent Advocate and Attorney Coalition. Another is the Council of Parent Attorneys and Advocates. And then another is the Michigan Advocates to End Seclusion and Restraint. And lastly, she's involved with Planned Parenthood Advocates of Michigan. Now I'm going to turn it over to Marisa to share her advocacy journey and the challenges that she's faced.
Hi guys, I'm Marisa. Thanks Diana for the introduction and for all the acronyms. I know it's a lot. I'm a mom of two. As Diana said, I'm in Michigan, and my professional background and my educational background is in social work, but I really came to advocacy as a mom from my oldest, Max. Max attends public school in a self-contained ASD classroom, so a lot of the advocacy kind of came as we were learning and as he was going through school, helping him navigate the special education system in Michigan, and then in tandem with that, kind of helping him through the behavioral health system as he was kind of accumulating these co-occurring diagnoses along with his autism diagnosis. So I also live in a township in Michigan where our emergency response protocols differ from the rest of the state. And Max is medically complex, so that's also been a focus of our advocacy, which has been another interesting part of my life. And there have also been some times when there are resources that I've tried to access. I think a lot of us run into this with our advocacy where you're looking for something and it doesn't exist, or it exists, but it's maybe not exactly how you would hope it would be when you try to access it. So I've done my part to try to build different communities and networks to stay plugged in and kind of keep me informed and educated as things evolve. So it's not always easy, but I think I've learned there are lots of different levels and how you can be involved. And that's kind of what we want to support you guys through, in knowing that there are some things that I do monthly just to stay involved in my advocacy. There are other things that I do daily. There are some things where I'm meeting with legislators occasionally to talk about legislation and try to make change in that way. And then other times you're just kind of checking in with your networks and families and friends that you know. So advocacy looks like a lot of different things, and all of it's valid.
Thank you, Marisa. That's great. Now I just want to, we can open it for Q&A right now. I want to keep the screen up so that if you have any questions about these groups that Marisa is involved in. But while you're thinking about any questions that you may have, I'll just start with Marisa in asking some questions. And one thing that comes to mind for me, Marisa, is where to start and finding the time to do this. Like, there was a point in my life with my son that, well, actually for many years, where I thought there's no way I can make time for this. Can you tell me more about how you are managing that?
Yeah, I think it's a constant balance. And I think you're finding a lot of times the people that are making the biggest change are the ones that don't have the time and are very much in the trenches. But we also have to make sure that we're taking care of ourselves and that you can be effective and advocate for your family and the people that you're trying to support. So I think the biggest takeaway that I've had, and the lesson that maybe I had to learn the hard way, is I don't always have to be the expert. You just need to be able to know how to find them. You don't need to know. Some of these systems are so complicated, and it takes so much time to learn, and to think that you could be an expert on disability and SSI and all these things is overwhelming, but you just need to know how to get plugged in with the information and how to find the right information. So I think that's the number one piece of advice that I would give, is just trust yourself to find the people that can help you, but you don't need to be an expert on everything all the time.
Mm-hmm. Oh, that's good. Thank you. Other things come to mind about my experience there. Up until I became involved, and I think a lot of folks may feel similar, you feel like an island and you are alone. And it's hard to see what's out there and on the other side when you're dealing with all these different things, and you're not sure who to reach out to, and there's stigma, right? So if you're beginning an advocacy journey, the best place to start, as we said, is with your child. But beyond that, what made you take the first step to becoming to this advocacy? What spurred you to take the first step?
I think my biggest frustration and the catalyst for me really becoming an advocate was something I had kind of touched on already. You see systems that are in place for your child or whoever you're advocating for, or for yourself, and it's not what you would need it to be in order to be effective. So that's when your voice is important. That's when you can offer that feedback in a lot of different ways. And it can be small, it can be daily, it can be occasionally, but you do need to provide that feedback and kind of push back on the systems that aren't working or aren't serving you in the way that they need to. I think there are some examples in my life where I've been able to do that. Like the seclusion and restraint work that I've been doing, that started out by attending an event by MEJC and really just trying to get involved in talking with people. And then that turned into attending a monthly meeting, and that turned into attending some advocacy events on behalf of Michigan Alliance, Michigan Advocates to End Seclusion and Restraints. And now that's turned into setting up coffee hours and having a say in the legislation. So I think, again, what doesn't work and what does, and that you can have an impact on it. So there's always a move. There's always something you can do to make a difference. But again, you don't need to take on the entire world. There are people that are doing the work with you, and you can walk alongside them.
Well, thank you for saying that. And we do have a question, but I did want to touch on the coffee chat piece. And it's my understanding that there are these types of gatherings with legislators here in Michigan and across our state. That's correct? That
Yeah.
folks can sit down with their state legislators in that environment and have the ability to connect and have some conversations. Yeah.
And a lot of times we encourage people to stick with their reps and the people that are representing them. But if there's an issue like exclusion and restraint, for example, I don't live in Hazel Park, but that was an area of the state where they were experiencing the highest rates of seclusion and restraint. So then you get on the phone and you call the reps and the senators from that area. And you just need to be able to jump in and have a conversation. And again, you don't need to know everything, but just
Mhm.
kind of putting a face to an issue can make a big difference when you're going to a legislative coffee hour, sitting down with somebody, handing them a one-pager on an issue that matters to you. It really does get that in front of the legislators, and makes the problem a real personal thing that they're kind of having to address and deal with then.
Mhm. Yeah, it makes sense. So, okay, thank you. So Sophia has a question. She says, Marisa, did you say you started in social work? And how has that come into play throughout your advocacy journey?
I did. I started in social work. So I was going to school for a degree in psychology and women's studies, and I didn't know exactly what I was going to do with that. I started working at Degage Ministries actually in downtown Grand Rapids. So that was working with a population of people that needed a lot of access to a lot of different resources, housing, employment, mental health support. So I think that has shown me probably that's been the clearest indicator to me that policy and funding has a huge impact on access to support, and that's where our voices are important, and that's when we can really speak up and try to advocate for ourselves and for others.
Mhm.
So that's a great question, Sophia. I appreciate that.
Mhm. I hope that answered your question, Sophia. Let us know. Let's talk about empowerment. There's a few questions that I have for you. Oh, thank you, Sophia. I think the empowerment piece is huge, right? It probably, for me, it caused a shift inside. I went from feeling like I didn't have any control to I had some control. I had a voice in speaking on behalf of my son. Did you have a shift like that too?
I did. I didn't want it, and I'm still kind of having trouble grappling with it a little bit, maybe. So one of the acronyms there on the screen is MIPTA, and that stands for Michigan PDA Support and Resources. So pathological demand avoidance or persistent drive for autonomy is a profile of autism that my son has been diagnosed with. And that is something where we are not able to find a lot of support, not only in Michigan, but really in the United States. So that's actually a network of families that I was able to start just through Facebook. You just have to start somewhere. And I didn't have any special qualifications necessarily to do that. I was just a parent who needed other parents to talk to. Um, I think that was a really powerful moment for me to realize I don't have to know everything. I just have to have a place to start and kind of this jumping off point. So we've created a network. We have support groups. We have peer support groups. We've been able to get connected with a lot of national organizations that have provided a lot of additional support to us. But I sat down with one of the other moms from MIPTA, and she finally said to me, like, you realize that you need to create the support you're looking for, right? Like, this is it. It's us. We have to make it. Maybe it doesn't exist right now, but we have to do it. And that was a tough pill to swallow, because I think as an advocate, you think your job is to just find it, find the resource. And sometimes resource isn't there yet, or sometimes it is, but it's not fully developed, or it's underdeveloped, or it's developed in a way that maybe isn't effective anymore. You need to change it. So that was scary, but also empowering for me to realize that I do have a voice and I am able to start a network like this, and I am able to provide support to people in a way that they might need. and then get support from them too, because really we're all just getting started and seeing where it takes us in a lot of ways.
Yeah, that's wonderful. Courtney says, my son is diagnosed with it as well, and I haven't been able to find any supports for it.
Well, come on over to MIPTA, Courtney. We have a lot of resources and we'd be happy to hear what you have to offer too. So.
And this is so great because Courtney is a new ACMH PAC member. Marissa, I was telling you about her. So you're both part of the PAC. So see, this is a perfect example of this in action and connecting, right? Connecting with each other, helping each other, increasing our voice to help make an impact. So this is great. Thanks for putting that in the chat, Courtney. All right, so while folks are thinking, there's other things on my mind. I love that you talked about that. That's very empowering. When it comes to conversations, I understand that you are sitting down with a state legislator coming up soon here, right?
Yes.
Tell me about that.
That again is stemming from my work with NSAR, Michigan Advocates to End Seclusion and Restraint. And that started very much on the ground floor with my son. My son Max is in a self-contained ASD classroom, as I had mentioned. Seclusion and restraint isn't something that we've had to deal with directly, but it's close enough to home that we wanted to be educated. And I think that's another piece of advice that I would give to as an advocate. You can learn as you go, and you can kind of do the baptism by fire version of learning and advocating and navigating the system. But if you have the ability to educate yourself on issues that will impact yourself or your family member that you're advocating for, take the time to learn. Because again, my son luckily hasn't had to experience seclusion and restraint in the public school system, but it was something where we then had a chance to educate ourselves and kind of arm ourselves with information and then stand as allies with families who have had to deal with this so far. And that started, again, just a meeting, learning more, getting involved, and then becoming a little bit more involved in attending events in Ann Arbor to kind of speak on behalf of what's happening and helping to get a little bit involved with these legislative recommendations that we're making. And there are a lot of local organizations like NSAR that need support and need voices and need people to do the work because it is all volunteer led. And the more people you have and the more hours that you have to dedicate to something, you can really make a difference. So we have a list of the coffee hours that we referenced before. Certain legislators that we've already gotten in front of, we have a list of coffee hours that you can attend on behalf of NSAR. We have the legislative recommendations that we've put together, and it starts with attending the coffee hour, kind of making them see who you are face to face, sending the emails. And then when you start to connect with them enough and they hear your name, they know your organization, and you request a meeting with them, sometimes you get a yes. And that's what happened. So again, I was able to join this group that has already done so much impactful work in Michigan, NSAR, and support what they're doing. So it's really just finding people that are doing the work that you're trying to do already, or creating the opportunities for yourself if they don't exist. But there's definitely a way to do it.
Thank you, Marissa. Sunshine asks, what's one moment in your advocacy journey that changed you, not just the system?
Oh, that's a good question. I think I'd have to refer back to the slides that Diana put up earlier about what advocacy is and what it isn't. And really realizing that we love the moments, right? When we can be like, I went in there and I told her but that's really not what it is. I think those moments when I realized I walked out of a meeting and I was calm and I was composed and I was effective, and maybe I was angry, but I was more composed than angry. That really changed me because we catch more flies with honey, right? And you can make more of an impact if you're collaborating. And it's not just about, I don't think it's manipulative. I don't think it's necessarily trying to play the game. You're just trying to be effective and you want an outcome for yourself or the person you're advocating for. So I think when you can walk out and feel really good about keeping it together and then maybe going home and losing it a little bit, those are the moments that have changed me a lot and made me realize, like, no, there's really something to this collaboration thing and not just coming in and yelling.
That's great. There's a strong empowerment element to that too. And I think that there's a shift there. And also when we're okay, right, the parents and caregivers, it helps our youth too. The environment is everything. So there's a shift there that can help. Does it take it away? No, not by any means, but moving into empowerment as opposed to not feeling like that there's anything out there for you and being alone. Sunshine, she says, that leads me to another question. Thank you, Sunshine. What do you wish people understood about the emotional labor of advocacy? That's a great question.
Fantastic question. Yeah. I've talked about this a lot with my husband and with friends and family, but I think people feel or want to believe that if you're an effective advocate, you feel calm and you feel ready all the time. And I've had to kind of tell myself it's okay not to feel calm. It's okay to be angry. It's okay to be sad. It's okay to feel incredibly defeated sometimes. I think the key is just being and feeling steady. It's not about being calm. It's about being steady. It's about showing up, and it's about being able to do it and do the work and get through it. And whatever that means for you, if that means taking breaks, if that means getting really loud and really involved, if that means knowing when to step back and when to take care of yourself. I think you just need to be able to consistently show up and consistently do the work, because it's very much a marathon, not a sprint with any kind of advocacy. Like you said, Diana, it's not a quick fix ever. So you need to be ready to take care of yourself in those moments and just know when you're feeling ready and you're feeling strong and you're feeling prepared, go ahead and do it. But if you're not, it's okay to step back too.
Sunshine says, great advice. Thank you. Thank you, Marisa. We do have some more content to cover. Oh, okay. So let's do it. Christina put a question in the chat. She says, I would like to make changes in my local community as we need programs and services for transition, as my son will be in need of these services to live independent. I am wondering what the most beneficial organization could be to connect with. Where might I start to be heard by my local community? Any advice here? I know that our next session is going to involve self-advocacy, and it will likely involve some folks who are classified as disabled. They're adults. They're living in local communities with support. So we'll learn more about that there. But does anyone have anything to share with Christina about this?
I know for myself, my oldest is 11, and trying to look forward to kind of that transition to supported independence for him and what that might look like. I've worked pretty closely with Michigan Alliance for Families, and they have a lot of information and webinars about that transition to adulthood. Wayne State University has a community transition trainers that Diana was referencing. So I think there are a lot of organizations too that can give you kind of the broad strokes, but I think we could probably try to maybe get a list together too of places that could help a little bit more. But yeah, there's a lot of information out there. It can be very confusing. So I think just partnering with somebody who can walk you through it and answer the questions that you have can make a big difference.
Yeah, I know for me, it's been more independent with my son. I didn't lean on an agency for help. He sort of doesn't fit into that classification. But Marisa, you said something that I thought was important. It's more broad strokes. It's about getting connected into the right resources and then obtaining guidance in those areas, I think. And we can definitely put a list together. I think that would be highly beneficial. Sunshine says, great starting point is to connect with your local community mental health. Yes. Yes, or your county's Department of Health and Human Services, DHHS. So across each state has a DHHS, which is Department of Health and Human Services, specifically the division that supports youth transitioning into adulthood. Beyond systems, community advocacy often starts by finding your people, other parents, caregivers, and even young adults themselves who've walked the same path. You can start small, organize a listening circle, host a community coffee chat, or even attend a local school board or township meeting to start building visibility. You don't need to have it all figured out to start being heard. Your lived experience is already the most powerful data. Thank you, Sunshine. That's wonderful. Centers for Independent Living, yes, they often support transition age youth. There's so much information around that. So Christina, we would love to get you connected, and anyone here, I'm going to move on because we only have a few minutes left and I have some more valuable information to share with you. Thank you, Marisa. Thanks everyone for your wonderful questions. I'm going to skip past that. Here's some resources here in the United States. On the left, I have Michigan resources. Each one of these is linked out to the site. So we have the Michigan Family to Family Health Information Center, Michigan Family Voices, the National Federation of Families. And keep in mind, a lot of these entities hold conferences that you can attend. And if there's something barring you from attending in terms of, finances, oftentimes they'll have scholarships for families, parents, and caregivers to attend. So I want you to keep that in mind. There's the Michigan Department of Health and Human Services, SAMHSA, the Substance Abuse and Mental Health System Administration. We've got the Michigan Alliance for Families. And then I put on the right-hand side here, it's an advocacy handbook by the nationalcouncil.org. That's a heck of a document that you could dig into there. Double checking. Yes, I'll be sending out the slides. And then on the top right, Marisa mentioned Facebook groups. I myself, that's where I got the most up-to-date knowledge and different resources for my son. A lot of time now, by this time, they're curating all the information, which is great. So you could get in, ask for help, and folks are right there with the information that you need. And then I put some global resources here because I thought it's important too. There's so much going on around the world in regards to mental health, prioritizing that, and especially for our youth. And again, I wanted to share with you that I do have some documents I'm going to be sending to you, and you'll also get a certificate. I want to highlight that ACMH has a conference coming up that you could attend. It's free. You have to pay $10 up front, and when you show up, you get your $10 back. Or you could donate the $10. We have a state legislator who will be there, State Legislator Hope, and the Lansing Mayor, Andy Shore, will be there. And that's on May 21st. So I have the links to that in the documentation that I'll be sending you. So just recapping, we discussed the basics of what advocacy is and what it isn't. We reviewed key areas where advocacy is needed. We identified some of the foundational advocacy skills that are needed, and we considered where to begin. We would like your feedback about this session and throughout all 4 of the sessions. That would be great so that we can work on making improvements and bringing what you need to you. So we appreciate your participation. It's completely anonymous, and we thank you in advance for that. Looking ahead, our next session is on self-advocacy and empowerment skills. So and then some of the future sessions, right? I said communication and the systems navigation and partnerships sessions are coming up. And again, the session survey there. So I want to say thank you for joining us. If you have any questions, feel free to reach out. If you're curious about anything in particular, I also have a QR code here for joining our Parent Advisory Committee that Marisa is a part of, Courtney's a part of, Sunshine's a part of, Monique's a part of here. You could feel free to complete the form at that QR code, and I'll reach out and we can have a conversation. So again, thank you so much. Watch for the follow-up message, and I hope you have a great rest of your day. Thank you. Thanks, Amy. Courtney.
Thanks, Diana. Great job. Thank you, Marisa.
Thank you, Sunshine.
Sunshine.